Good afternoon. I'm Jessie Watrous, an evidence-based practice director here at the Institute for Innovation and Implementation, University of Maryland School of Social Work. Thank you for joining the webinar today, High Quality Implementation of Evidence-Based Services at Scale, Supporting Practice at Every Level. This webinar is one in a series of webinars on strengthening services for youth and families by using evidence and partnership. It's produced through collaboration between the Kemp Center, Judge Baker Children's Center, and University of Maryland, where I sit. I'd like to introduce you to Dr. Sue Kearns, and she's going to get us started today. Thanks again.
Thank you. Can everybody hear me okay? Can you see the screen? Great, wonderful. Well, welcome again to our webinar. And as Jessie had mentioned, we have an exciting webinar in store for you today. I am delighted to be presenting with some fabulous colleagues who are listed here on this slide. Each one will introduce themselves as we move through the presentation. And I myself am Sue Kearns. I am located at the University of Colorado Anschutz, and I'm at the Kemp Center. And as we mentioned, I'm here with Jessie, Geetha, Lauren, and Bob, who are all going to be helping facilitate portions of this webinar. Today, we're going through several different agenda items. The first is just, I'm going to give a very brief overview of some general principles for effective practice change. I'm not going to spend too long on those overall principles because we want to get pretty quickly into sharing with you some examples of a practice change initiative so you can see what this could look like. And then hear from Geetha and the work that she's done that brings forward some of the voices from the field that describe what the impacts of some of these practice change initiatives look like. As we do that, we will then move to having a facilitated small group breakout, which should enable you to have an opportunity to take what you've heard in this webinar and consider how it might be relevant to the work that you're doing. So we're looking forward to a nice action-packed agenda for you for this next hour. So I'm going to start with just, I have here a slide that shows a picture of some ingredients and talking about what are some of the key capacity building factors across the system that support bringing evidence-based practices to scale. And you're going to hear much more about this in Lauren's presentation. So I'm not going to go into defining details about how we assess and understand in a system who might benefit from an evidence-based practice or practices, engaging families in treatment, matching to appropriate treatments, and tracking outcomes over time. I'm going to say here that the challenge that's in front of us is how do we put these ingredients together in a comprehensive and strategic way that produces something that's meaningful, understandable, sustainable practice. It's important as we think about each of these steps to consider each of the potential professional roles within a system, whether it's an agency, organization, community-based practice, but who has a role in ensuring that these capacity building efforts are implemented on the ground, and how do each of those professional roles potentially influence or impact the success of your implementation efforts. And in addition to the specific ingredients and the specific roles, it's critical, it's vital to consider the role of communication and collaboration between those roles and between those systems in our comprehensive system change efforts. We're going to hear a lot more about this again throughout the presentation as well, but want to highlight that it's sort of that space between that how people interact and understand their roles and responsibilities that can make or break an implementation effort. I also want to note that each of these stages here represent distinct decision points within a system, and how we structure our implementation can have far-reaching impacts as it relates to equity and how families experience the system, who gets access to those services, what choices are made along the way. And so ensuring that you're having consideration to those aspects and how those decision points could influence your overall implementation is really critical. And then finally, I wanted to talk about just that it is important to consider capacity building across all of those different elements for longer term sustainability of evidence-based practices over time. Easier said than done, which is why we're excited to provide you with an example as we move forward of what this can actually look like. I also wanted to just acknowledge that there are several different support roles that are keys to supporting practice change. And although therapists or practitioners, child welfare professionals, and others may be the implementers of a practice change initiative, or the ones that are actually sitting directly across from a family or a child doing the technique or the practice or program or service, that it's really critical to think about the roles of supervisors and administrators in creating a system that's going to be sustainable over time. So for example, administrators may support adjusting policies and practices and procedures that provide incentives and clear direction around roles and responsibilities for implementation. Supervisors can play a really critical role in helping practitioners to translate between knowledge that they gained in a training or through an implementation support to the families that they're working with directly. And also can be really helpful in thinking about how to overcome implementation barriers that pop up even with the best planning in place. We know that implementation is hard and roadblocks happen, and supervisors can be uniquely positioned to be able to help navigate some of those pieces. I also want to acknowledge that as we're thinking about practice change efforts, the roles of intermediaries and implementation teams is not to be understated. They can play really invaluable roles in helping to support and navigate systems change efforts. We've talked about both of these in prior webinars, so I'm putting a plug in here for if anyone hasn't been to our prior webinars on those topics, that might be a nice way to see how those supports can really make a big difference in your implementation efforts. So with that, I'm going to turn things over to Lauren and Geetha. And as I do, I want to encourage participants to put questions in the chat box as they come to you. We'll be monitoring those questions. We'll try to get through those questions either during the presentation or during the Q&A. Any questions that we don't get to, we'll attempt to follow up with folks and address after the webinar has concluded. So with this, I will turn things over to Lauren Coleman, who will share with us about partnering for success.
Thank you, Dr. Kearns. My name is Lauren Coleman. I am a training manager at the Institute for Innovation and Implementation, and that includes the training for Partnering for Success. So I'm going to talk a little bit about that now. When we're talking about partnering for success, we're talking about a model that develops partnership across systems at every level to better the outcomes for children, simply put. So in Partnering for Success, we're generally talking about child welfare and juvenile justice, partnering with EVPs, which is how I'll refer to it today. But this is a model that can be used in many child serving systems and by anyone in a role where they are coordinating care. So you'll hear me primarily reference training on the child welfare and juvenile justice side. Sometimes we train those entities individually, and sometimes we co-train, for instance, child welfare with mental health providers simultaneously. So there's a number of possibilities, but you'll hear me largely focus on the model from the child welfare and juvenile justice side of the partnership, just to give you a sense of what this consists of. Next slide. So as we've said already, Partnering for Success supports systems partnership at a number of levels, including leadership and an implementation structure. I'm going to focus the next several slides with a broad overview of the partnership practices that you see here that are intended for direct practice with families and are the foundation for Partnering for Success. And I'm going to highlight some of the tools and strategies used to facilitate partnership and collaboration. But I'd ask you to keep in mind, just like Dr. Kearns mentioned, that the support of leadership and the importance of meaningful implementation means that these practices are supported at every level in a system or agency. Next slide. So I'm going to start with assess, and you'll see the definition we use in Partnering for Success on the left on each slide. I'm not going to go into that in great detail, but I'm going to talk about a few of these components, again, just to give you a flavor for what this consists of. So with assess, the emphasis really is about a comprehensive process and the importance of achieving as full an understanding as possible of a family's unique story. So that means seeking a variety of information sources, including conversations, observations, collaterals, standardized assessment tools to help us really gain a more full picture and reduce the likelihood of misunderstanding the family story, missing a key piece of information, and therefore hopefully reducing the likelihood of potentially seeking an intervention that isn't quite the right match, right? We really want to lead this towards a fine-tuned match whenever possible. So right from the start, we're establishing partnership with the family and others that might play a key role in their life and thinking ahead to how this type of assessment will likely lead to a strong match with an EBP. So even at the point of assessment, we are setting the stage for a strong partnership with other providers. This full understanding of a family story is really crucial so that we can learn their unique combination of needs, strengths, culture, and identity. Assessment is a stage in which we have the opportunity to address some of those factors that lead to disproportionalities and disparities in ethnic, racial, and socioeconomic factors in child-serving agencies. So it's a stage, like every stage really, where we have the opportunity also to be working to understand our own biases, stereotypes, assumptions, so that, for instance, I can really be aware of some of the beliefs and experiences, the cultural lens I have, in order to attend to the family and the individual with openness and curiosity and cultural responsiveness. And then what this does is, again, set the stage for that partnership with the provider, because this well-developed understanding of all aspects of the family's strengths, needs, and identity also leads to a better ability to make an individualized plan, make a targeted referral that matches the needs and strengths in the assessment, and can attend to setting up the provider for success, right? Because we have the ability to help them be responsive to the individual or family's culture and identity, as well as maximize their current strengths and resources and facilitate a stronger partnership with everyone involved and that collaborative approach. And then as we continue to partner, that baseline assessment that we've done that's really thorough allows us to reassess and establish an understanding of progress throughout the work together. Next slide. So when we talk about engage in Partnering for Success, I want to clarify that we are specifically talking about engagement with the EBP provider and the family. So engagement is obviously critical from the first moment, and we talk about working with the family to establish engagement throughout the assessment process. But I just want to be clear that right now I'm going to be talking about that engagement between the provider that we are connecting the family with, so that we can, again, establish that partnership and start off working together in a really strong way. So in terms of this core practice, we're really talking about intentionally and thoughtfully facilitating the partnership with the family and the EBP provider. And at its core, the quality engagement is rooted in aspects of common factors theory and the understanding of the impact of relationship building and interpersonal factors that contribute to positive outcomes. So what we train on is an evidence-based method for engagement called the McKay engagement steps. And these steps provide a structure for child welfare or juvenile justice worker to use in order to really understand what is most important to the family and connect that to the purpose of the EBP, as well as to identify and provide support around areas that may be current or potential barriers to partnership. So when we explore potential barriers, these primarily fall into categories of concrete, perceptual, and cultural barriers. And there's evidence that addressing cultural and perceptual barriers is more impactful than solely addressing concrete. So I'll give you a few examples of those barriers. We're talking about things for concrete, such as transportation, location. Perceptual barriers include things that such as stigma, past negative experiences with a provider, and cultural might be acceptance or lack of acceptance by a family or the community that they are a part of. It might be experiences of racism or other forms of discrimination. So a child welfare worker or juvenile justice worker's ability to be aware of and validate and acknowledge and problem solve up front is critical to increasing the likelihood of engaging this partnership. And again, before the family has even encountered potentially the EBP provider or other intervention, we're again setting the stage for all parties to partner together. So this work of engagement done early and ongoing really strengthens the family's engagement and makes the likelihood of strong partnership higher. Next slide. And before I go into match, I'll just say that for the sake of training, we go through each practice in a linear fashion, but it's really important to recognize that this process is, of course, not always linear. And particularly with engage and match, there may be a lot of moving back and forth between the two practices as you simultaneously research available options that might be a potential match and work with the family to engage them in identifying their own needs, priorities, and barriers and how that aligns with the options available to them. So the ability to make an individualized match is a reason why that thorough assessment I talked about a moment ago is ideal. And then when we are at the point when we're seeking a provider, a key tool that we use when we match is a structure for gathering information about a provider, which we call the informed consumer questions. And they really are that, to be the ability to be well informed about who this provider is, the type of work they do, and how willing and able they are to partner. So in the best case scenario, we've actually had workers who have helped empower the family to be comfortable using these questions, because at the end of the day, we want them to be equipped with the tools to be informed consumers of their own services. And then finally, when we train on best practices, when we make referrals, we ideally want folks to be making a warm referral. This is a practice that includes an actual conversation and personal connection in addition to, required paperwork, et cetera. And you can see how this has the potential to really set the stage for partnership as the norm, as the way we're going to operate, right? So this is also an opportunity to share those relevant cultural factors, strengths, any barriers to access that might need to be solved. This is an opportunity to establish right at the beginning regular check-ins and the steps around progress monitoring. And I'll just highlight here, this is a good example to think of the role that agency leadership can have in facilitating a referral process like this, to set the expectation and to identify mechanisms for this type of information exchange. So of course, there's dozens of ways that leadership and implementation can be effective and be thought out here, but I just wanted to throw that one example out there. Next slide. With TRACK, we are working to be very intentional in measuring progress beyond a vague, how are things going? We train on a tool that provides a structured process to inquire about 5 key aspects of the EBP. This includes level of attendance. That's an easy and probably the most common one. But also the level and quality of participation of all involved, the family member, the individual, and what the provider is doing to enhance and support participation. The third aspect is questions around the intervention itself and what strategies, tools, and resources are being used with the family. And I'll sort of sidebar here to say, tracking progress is not a one-way street. This is an opportunity for instance, the child welfare worker or the juvenile justice worker to be able to learn what is being done in the intervention, really reinforce and support skills and strategies the family is using, and to the degree they're able, practice that with the family as well. And then potentially share back with the provider what progress they're seeing. So this two-way feedback loop is obviously the hallmark, right, of excellent partnership. It increases the likelihood of positive outcomes for all parties. To be honest, increases the buy-in, right, for partners to work together, because it really makes everybody's job a little easier too. And then the fourth aspect we make sure that folks inquire about is what learning the provider is seeing the family experience growth and what methods and results of evaluation that they're seeing as well. Tracking includes additional strategies just to give structure and consistency to that process of determining progress. So this includes what we're tracking. Is it the family's vision and desired outcomes, the needs, the reason for referral, as well as how we're tracking it, how we're quantifying that, the baseline and regular intervals, and then who participates in tracking. Ideally, the child and youth to the degree they're able, the family, and the provider and other folks who are involved. And then finally, we want child welfare workers and juvenile justice workers to have the capacity to support adjustments and transitions, right? So this includes considering options when progress is not made, when adjustments are necessary. And I'll say that having established a partnership already and ongoing communication makes navigating a conversation like that a lot easier, because it can be a difficult conversation to have around when things aren't going well, what should we be doing? And then ultimately, we want folks to have the capacity and intention around that transition when goals have been met. So celebrating that success and having a clear and written plan for the transition and beyond. So that was a very brief and broad overview of some of the fundamentals of Partnering for Success, just again to give you a sense of this initiative. And in a moment, I'm going to turn it over to Geetha so we can hear voices from the field. But I just wanted to ask if there are any questions that I can answer right now.
There were none in the chat.
All right, then I'll turn it over to Geetha.
Okay, thank you, Lauren. Hello, everyone. My name is Geetha Gopalan. I am currently located at the Silverman School of Social Work at Hunter College in New York City, formerly on faculty at the University of Maryland School of Social Work. Next slide, please. So I'm going to talk about a qualitative study that was performed back in 2017 when Partnering for Success was really in its infancy. It was the first conducted around the third year of our implementation. And at that point in time, we were focused on collaboration between child welfare and mental health providing systems. And what this study involved was collecting interviews from frontline, supervisory, and executive level staff on what helped with implementation, what benefits they saw. And these findings were then utilized to help with the cross-site implementation teams for improvement. Next slide, please. So this is a table, I like tables, that just kind of overviews some of the factors of what helps and what hurts communication and collaboration. And I'm going to go through some of the exemplars and summarize them. I'll let you read through them on your own if you have access to the PowerPoints. And then because I won't be, unfortunately, I apologize, I won't be able to be available for the breakouts. I'll take a few minutes for questions afterwards. Next slide, please. So as Lauren mentioned before, referrals are a key part of partnership, and at least according to the providers, having this fast referral turnaround is key to maintaining that partnership and collaboration. Next slide, please. It's also helpful that the quality of the referrals themselves have been improved through this program. The mental health providers are getting a lot more information than they might normally get, and that helps to reinforce the partnership. Next slide. Another thing that's important is not only just having the training for the partnership and for the evidence-based practice in question, but making sure that everyone in the agency is also trained in it. And in this slide, I'll summarize what this administrator talks about is early on, they only did trainings with those folks that were interested in the agency. But what they found is it wasn't enough to really institute practice change across the referral base. So what would happen is child welfare workers would make referrals, but there may not be necessarily enough mental health providers trained at the agency in the EBP to take on those referrals. So that really became problematic until everyone in each prospective agency could be trained. Next slide. And the saturation of training also helps to promote buy-in within the agency. So as the supervisor talks about, the more people who are trained in the model, who do it and are successful with it, it helps to spread the word. It helps to develop a culture change that can help frontline supervisory and administrative staff really buy into this. Next slide. So what helps with communication is frequent and responsive communication. And so this is an example from a caseworker of what working well together really meant. And here you can see that the caseworker and the mental health provider really collaborated via email, via phone on a shared client, and they were responsive with each other's concerns and questions and were helping each other problem solve. Next slide. Additionally, what has also come through is email and written documentation also helps with some accountability for communication. As we heard a lot through these voices from the field, sometimes it's hard to get folks on the phone. So using email seemed a little bit better in terms of communication and also having a record that communication was sent. Next slide. And if all else fails, contacting supervisors is also noted as another way to ensure that partners are able to communicate with each other and these messages and information on shared clients could be relayed successfully. Next slide. On the other hand, communication collaboration is definitely hurt when there's confusion of who to work with at the other agency. So in this particular exemplar, they had difficulty figuring out who to contact at the mental health agency, especially in situations where there is high turnover. This can be problematic, particularly when you need to make fast linkages and knowing who is going to be responsible for which part of the process. Next slide. We also found that in spite of our training for the partnership and their different roles, that there was still some hesitance from mental health providers to share information, likely due to some of the HIPAA restrictions, but it's also, overall, it's a culture change from having to share information on shared clients that they're not necessarily used to. And so as reported by this child welfare provider, it was a process to try to get the therapist comfortable enough to be able to share information on clients. Next slide, please. Scheduling difficulties are also problematic. As you probably all know, child welfare workers and people working in juvenile justice, as well as those in the mental health field, are very, very busy people. And so it's often the issue that they get into phone tag. So having a scheduled monthly call was really helpful. Next slide. It was also really helpful in the very beginning of the partnership to establish mutual role expectations. So the very beginning of working together, both providers from the child welfare and mental health side had a frank conversation about who's going to do what are the different roles that they're going to take on and how that's going to look like. Next slide. This leads to a clarity of what the process is. So once everyone is on the same page of knowing what the structure of the referral process can look like, about the matching, about the tracking, then it really helps with keeping the process fluid. Next slide. Conversely, when there's some resistance to accepting some of those new roles, in this case, this is a child welfare caseworker responding to some of the resistance from the mental health therapist side of having their treatment or progress monitored around a shared client. And so what we see here is kind of a turf issues. And, how do we respect each other's lanes, so to speak, but also maintain that collaboration? That's really key to work to helping shared clients. Next slide. Similarly, when there is a lack of role clarity, that can lead to some confusion. In this particular exemplar, this confusion was on the child welfare worker's role around reporting abuse and neglect. And so having some clarity for the mental health provider was really helpful. Next slide. Ideally, having a strong working relationships with partners is important. And this, really helps with communication and collaboration, but it is about that relationship and making it as healthy as possible. Next slide. And what we found was when there were opportunities for face-to-face interaction, this really helped with that relationship. And so early on in this project, we had joint trainings for child welfare and mental health providers. And both providers from both systems really valued the ability to have these frank discussions to develop the empathy for each other's roles. Next slide. Conversely, collaboration could be hurt and hindered when relationships felt one-sided. In this example, the supervisor spoke about how workers felt like they were giving a lot of information to their mental health partner, but not really receiving enough back. And so ensuring that those relationships are really balanced is important. Next slide. One of the critical things that's been helpful, at least from the perspectives of the staff, was problem solving at the executive level, where the administrators really take a proactive role in identifying challenges and trying to resolve them in real time. Next slide. Another thing that was really helpful from the provider's perspective is the shared language that was developed as part of the partnership and the training. So they had words, jargon, terms that they all understood and they all knew what each other meant. And that helped to make the contact with each other less burdensome. So they could just give bullet points as opposed to giving a lot of contextual background information about what they were doing. Next slide. This also helped to build buy-in, not only with the workers and the providers themselves, but also with the families. When you can utilize the shared language, for many, what I heard from some of the workers is there was this aha moment for many families that they could put a term to what they were talking about. And so this is definitely helpful with some of the buy-in, not only between the providers, but also with the families. Next slide. Okay, so I think we skipped some slides there, actually. Okay, I think we're done then. Okay. All right, so before I sign off, is there any questions that I can take from you all? Okay. I'm not seeing any in the chat. So if there are questions, please email the webinar organizers. I'm happy to respond via email. And so I hope you all have a great discussion and look forward to hearing your questions. Thank you.
Thank you so much for a wonderful presentation. I think it's always so impactful to be able to see the broad concepts of what a systems change initiative might look like, and then hear what were the things that made a difference. And as you heard from Dr. Gopalan's presentation, everything from sending emails to executive leadership change, and everything in between are important things to consider. And so just really terrific. I know putting those on slides does not highlight the amount of work that collecting that type of information creates. And I know that was a lot of effort to collect and condense and collate. And I think that's just really, really terrific. So thank you for sharing that. At this point in the presentation, we're going to move to some small group facilitated discussions, and I have some prompting questions on the slide here as well. And I have copied and pasted those so that we can talk about them in our small groups, and the other facilitators may want to do that as well. So you have those handy as we break out into our groups. We have about 15 minutes or so for our small group activity, and then we will come back together and do a collective discussion about what we learned, and also have an opportunity to address any additional questions that come up in the chat. So with that, can you please open the breakout rooms, and we'll see everybody back in 15 minutes. Finished a really nice, robust discussion. I'm eager to hear from the other breakout groups as well as to what you were able to cover in your sessions together. So why don't we get started? And Bob, since you're on the top corner of my screen,
Okay.
I'm calling you first. How's that?
Yeah, we had a great group. We had a couple folks who were in cubicles, couldn't turn on their mics, but we used chat and we had some great examples. And what I really love that came out in our discussion was sort of the importance of building relationships and creating safe spaces where those relationships can develop. We talked about use of grouping people both around affinity groups or grouping people around common themes such as topical issues or questions that would come up in an implementation, and really thinking about how to engage people at multiple levels within a system. But there was a real synergy and emphasis on this idea of that it's really important to build that sense of trust and build those relationships. And sometimes starting small is the way to do it, in small groups that have some affinity around a topic or an idea or a role, and then building out from there as we engage other parts of the system. So I think those are sort of our main themes, but some really great examples were provided.
Jesse, how about your group?
Well, our group had some great, I think, systems thinkers, because they were raising this idea of, so we talked about we used the magic wand was our question. And it was about the idea that we need to really strengthen kind of that web between systems, and particularly that education is left out and yet the primary point of access for like every family, almost, and so looking at like that web and going, where is the school in that web of interconnected service, systems, and kind of noticing that the other thing that was really interesting is this idea of integration, and that it often is becoming like a two, maybe like, mental health to substance use, or mental health and substance use integrated with healthcare. But like as systems get more integrated, as we've talked about in Partnering for Success, mental health and child welfare getting more integrated, that pathway is being constructed in really different ways all over the country, and wanting to see more models of how that pathway of interconnection can be built. I think that's what I heard. And it was really great conversation. So thank you.
Wonderful. Our group, Bob, as you were starting to talk about your group's discussion, we went right there as well about the importance of relationships. And our group actually started really talking about, at first we were like, wow, well, does, COVID and some of the challenges that we've experienced over this past year created barriers for building those types of relationships, because you can't really have that in-person opportunity, but pretty soon debunked that idea, in that the other theme that our group really was talking about was access, crossing lots of different lines, but how the shift towards people's broader comfort and opportunities with tech allows for more equitable participation in different things and events, and makes things easier in a lot of ways for people. And so we're talking about that piece. I think we also, we had a big theme around access in general, and then also service availability, and how, thinking and considering capacity building efforts to really make sure that we're focused on, that there are the same services are available for people, not just by the accident of where they happen to live or the neighborhood that they're in, or that kind of thing as well. And how do you leverage capacity building efforts to help support that? So I think I'm kind of looking, a couple of my group members are on their video. Did I miss anything really important? Got it? Okay, great. Well, at this point, we have just a minute or two if there's any burning questions that folks have. I actually haven't been on the chat here.
There was a question that we got raised earlier about the education's role And I just, we asked, there was an ask that we maybe came back to that if there was more of an answer around that, like, and so I don't know if the person who raised it, I believe Peggy was her name, wanted to say that again.
Yeah, Peggy, do you still have that question, or was that something you're able to get to in your small group? Or can Peggy unmute herself if
there? Am I unmuted? Okay.
Yes.
Yeah, I think the question is generally answered, which is the school to prison pipeline. If you guys aren't including the schools in the school to prison pipeline solution, you're not solving it. And so it's just more of a statement that needs to be included in your conversations.
Yeah, thank you. Agreed.
So thanks, Jesse, for bringing it back to the table.
There's room for more. People have them.
Any other questions?
If you have a question, you can go ahead and unmute yourself.
Jesse, I think it may be time for you to close us out. Tell us what's next. Okay.
Great. I don't know if you want to share the date for our next webinar. So I would like to invite you. This is, as I mentioned at the beginning, this is one in a series, and we are actually having our last webinar in the series. I invite you to go to the website here and check out the recordings from the past webinars. They really have built on each other, kind of starting with a 101 around what is evidence-based programming, thinking about infrastructure to support quality implementation, and selection of evidence-based programs to be able to fill service area gaps. And today's session obviously is talking about that practice change that's required and how you support it. And next session will be on October 21st, 2:30, and it's going to be looking at funding and how you leverage funding to support your EBP priorities. So I hope you will join us, and thank you very much. We really appreciate you joining today. Hope to see you soon.